At this time, I'd like to introduce Isaiah Hughley, who will now present our program.
President Tyler, fellow Rotarians, it is my honor to introduce today's speaker, our mayor, the 70th mayor of Columbus, Georgia, the Honorable Skip Henderson. It is exciting to have the opportunity to work closely with Mayor Henderson daily as he works to build a better Columbus. Mayor Henderson has really been busy during the COVID-19 pandemic. He has been busy trying to ensure our citizens remain safe. He has been busy making sure that citizens of Columbus are getting the essential city services needed to maintain good quality of life. Mayor Henderson is not a stranger to any of us. If you have lived in Columbus, then you know that Mayor Henderson has been working for Columbus for more than 20 years. Mayor Henderson was elected more than 20 years ago to post 10 city council at large. He served 9 of those years as budget chair for the consolidated government. He has been active in the community with numerous organizations. He has served as chair of the Better Business Bureau, March of Dimes, Kiwanis Club, and held positions on various other boards and authorities. Mayor Henderson and his wife, Karen, of 36 years, served together on the Leadership Council for the American Cancer Society. When Mayor Henderson was sworn in on January 7, 2019, he hit the ground running with a progressive agenda. His commitment to improving the city is unwavering. He is committed to using his experience, perseverance, and passion to ensure that our city is livable, connected, and unified. Mayor Henderson simply wants every citizen in Columbus, Georgia to be able to live his or her best life. Mayor, on behalf of President Tyler and my fellow Rotarians, welcome and thank you for your willingness to speak to us today. Fellow Rotarians, I present to you the 70th mayor of Columbus, Georgia, the Honorable Mayor Skip Henderson.
Well, Mr. City Manager, thank you very much for that kind introduction. It may be the best thing they hear all afternoon, but I am very grateful to the Rotary Club for inviting me back. Visit y'all. I hate that it's under these circumstances and that we're unable to kind of gather together in the Trade Center. But I am grateful, and the city manager is correct. One of the, in fact, I had somebody approach me that was a very good supporter of mine when we were campaigning, and he apologized. And I said, "What are you apologizing for?" He said, "If I'd have known this was going to happen, I would have never urged you to run." Actually, I think sometimes God puts us where we're supposed to be, and I think He put me in the middle of an amazing team, headed up by our city manager and his executive management team. You know, the word unprecedented has been used a lot, and not without reason, because I don't know anybody that has had to navigate the creation of a city budget, the operations of a city government, which is a municipal corporation that employs some 3,000 people, as our city managers had to do, and do so in the midst of a pandemic. And of course, as we all know, this medical crisis has some very real financial implications that are accompanying it. But anyway, I feel like I've been blessed to have had the opportunity to work with the individuals in this community, including our Homeland Security folks, Chief Robert Futrell and Riley Land, and our first responders, our department heads, Fort Benning, General Brito has been an amazing resource for me for being able to contact him and talk a little bit about what they're doing at Fort Benning and what we're doing here, because it does impact, one impacts the other. And Mayor Copeland from Smith Station, as well as Mayor Lowe from Phoenix City, we're all kind of in this together, and we've been pulling on the same end of the rope, as it were. I'm going to try to be brief because I'd like to save some time for your questions. I'm going to try to answer a few questions that I've heard most commonly as we've been going through this really unique situation. One is, what has the government been doing? When did we begin? What was sort of the timeline? And I can tell you that we started on bi-weekly statewide calls that were hosted by the state health department back in the second week of February. We actually pulled together reconvened a committee that was stood up back during the avian flu, and it was the mayor's medical response team. And this committee had representatives from Fort Benning, from the hospitals, from the school district, from our public safety, the city manager, and just anybody who might have some influence or impact on how we react to something of this nature. So that was in, I think, the 24th of February. So before we even got to March, we were already positioning ourselves to be able to do whatever we could to try to make sure the citizens of Muskogee County specifically, but our region as well, remain safe, as safe as possible. Matter of fact, I remember we were, I think it was March the 3rd or 4th. It was whenever the Toast of the Town event was. Karen and I were attending that, and everybody's hugging and shaking hands. And we heard that night about a group of travelers from Columbus, a group that had been to Italy, and they were flying home. And got up the next morning and made a very awkward phone call to these individuals who are friends of mine. As they arrived home and found out there really was none. So I made a request of them that I was very grateful they didn't hang up on me, but asked them to stay at home. At that time, we weren't using quarantine or social distance. We just said stay home 14 days, and they did it. And the reason I tell that little tale is because, to me, that's what has helped this community weather this storm as well as we have. And it's not necessarily the government. It's not even necessarily the health professionals. It's the people that live in this community. They bought in early, and they went all in on doing what they could to try to prevent the spread of this virus. I'm going to share some numbers with you in a little bit, just to kind of give you some idea of some of the numbers we track in an effort to try to determine trends. But as I had that conversation with those individuals, they all agreed to kind of remain self-isolated for a little while. But about the second week of March, we restricted access to some of our venues that might attract larger gatherings, such as the Civic Center. Cost us a lot of money. We had a concert that typically draws around 8,000 to 9,000 people that was scheduled, had to be canceled. We shut down our rec centers. Believe it or not, there were some weddings and some receptions that were scheduled there, and we weren't able to hold them. We declared a local state of emergency about the 20th of March. We went so far as to suspend some of the non-essential waste pickups. We decided that because some of our individuals might be in danger of contracting this disease because of the close proximity in which they were forced to work, specifically our recycling facility, those individuals, to do their job, they stand literally shoulder to shoulder. So we suspended those for a little while. And we began to put some restrictions on our citizens. We were hesitant to do so, but we felt like it was the best way to try to ensure the opportunity for everybody in our community to stay safe. Then, of course, the governor put his state of emergency in place and issued a shelter-in-place order. and placed some additional restrictions. And one of those was it suspended all local orders and ordinances. So as of the moment he enacted his executive order, our local orders no longer applied. And we've been operating under his orders since then. I want to share a few numbers with you, and these are not a complete list of what we monitor, but I did want to show you where Columbus is. We are, as of right now, or at least this morning, we have 392 active cases, or not active cases, but we have had 392 positive results from testing. We've lost 15 lives of people who lived in Muskogee County who have passed away. And the hospitalization rate, now the number I'm going to give you is not the total of people in the hospitals right now. This is anybody who needed to be hospitalized from day one. And I think we're right around 78. So those are the numbers we kind of track. Now, I'm going to try to do something here that is way above my my capabilities, but I'm going to see if I can pull up a few of the graph information that that we review on a regular basis. All right, first, what you see here is just a graph. Now, we've been tracking this, and I've got to give a shout out to my office. Becca Covington, Alexis Thompson, they have done an awesome job distance working from home and answer all the phones, handle all the scheduling, get everything done. My chief of staff, Richard Bishop, he does a little bit of everything. But one thing he's really devoted himself to is tracking these numbers, charting them so that we can spot trends. Because I want to warn you, don't take any one number as a key indicator, because it's really not. What we look for is trends. And if you look at this is a graph of the testing that has been performed through yesterday, primarily by the Department of Public Health, but also in conjunction with MercyMed. And if you notice down there around the 6th of April, there was a huge jump. That was the result of a massive testing effort, a partnership with DPH and MercyMed, where they did about 1,200 tests in 3 or 4 days. So what you're seeing is an indication of the more testing, the more positives. Now, the good news is that while the state usually has been hitting right around 18 to 20% of those tested that are positive, our number is closer to 10%. So I think one of the things you can attribute that to is the consistency that our residents have shown, and their willingness to try to follow CDC's guidelines. Now I'm going to show you a slide now that shows the number of cases. Now, if you notice, around the 8th and 9th of April, you saw a pretty good jump in positive cases. And that's sort of been a trend. If we have a massive amount of testing, and it does happen, when we first started in March and early April, the DPH was lucky to get probably 40 to 50 tests every 2 or 3 days. Well, now we're testing at a clip closer to 100 a day. And you can see, now you've heard people from the beginning talk about flattening the curve. This chart is what a flat curve looks like. And what the intention of that is to make sure that your hospital resources don't become overwhelmed with a sudden spike that dumps a lot of people into the hospitals. Our numbers are running somewhere around, as I said, between 10 and 12% of those we test turn out to be positive. And of those, usually around 20% will end up in the hospital. And then once they end up in the hospital, then you run about a 60% chance of them ending up in the ICU. But as you can tell, our increase has been gradual. Even though our numbers are going up, as I said, I believe that's a direct result of just much broader testing. We've done probably close to 3,000 tests through the Department of Public Health and MercyMed. Well, there's also a lot of tests being done in the hospitals, which is anywhere between 500 and 1,000. We just don't know how many were done just on Muscogee County residents. But if you do the math, that means we've tested so far just about 1 out of every 50 residents in Columbus, which is a pretty solid testing performance. The slide I'm showing you now shows the number of patients that are hospitalized. This is within all hospitals in our region. This is a blended number. It's not any one hospital. You can see that our surge, at least so far, appears to have hit in mid-April. But our hospitalization rate has really sort of stabilized. It's actually declined over the last several days. And this is the key number for us, because we want to make sure that if there is an event where we suddenly see a surge, that our hospitals have the resources to manage it. And by all indications, they are as prepared as they can be. And by the way, on the outside chance that a massive surge overwhelmed the hospitals, we've already made arrangements. We've got a couple of locations where we could stand up 40 to 50 beds in probably less than 8 hours. This is just a chart that also shows you the availability of some of those resources, like ICU beds. It ebbs and flows. As I told you, people will work their way out of the hospital. Then when they are admitted, they do have a good chance of ending up in ICU if they are COVID positive. And then this is just an idea of how many ventilators are available. And it seems that those numbers have gone up as well. So that's just a little bit of an example of some of the numbers that we follow. And the main thing I want you to take away from that is that we are we're monitoring these things. And again, the things that we're really concerned about is our trends. So, and I hope I didn't lose y'all. Let me see. There, hopefully that's back. But anyway, we are monitoring these numbers on a daily basis. We're in communication with people from hospitals, people from Fort Benning, as well as our Homeland Security individuals. The main thing I need to get across, though, from our office perspective, we know the governor's relaxed some of the restrictions and regulations on what facilities can open. Our message has pretty much stayed the same. And that is the only real weapon we have to combat the spread of this virus is ourselves. It's our neighbors. It's making sure that we are social distancing. We're washing our hands. We're staying home if we feel sick. The governor has extended his executive order as of today, actually yesterday, and extended through May 31st. Some of the requirements for the social distancing, the conditions upon which restaurants and salons and some of the other industries can open. We are on the 18th going to be opening some of the government buildings back up, not all government facilities, but we will be opening the administrative offices. Now there will be a policy inside our facilities that employees will wear a mask if they're interacting with either a citizen or another employee. If they're in their office and they're not around anybody, obviously they can take it off. We're going to continue to take the temperature of individuals accessing the government facilities just to make sure that they don't have a fever as they come in. And we're going to strongly urge and have available masks for the people who enter the facilities. Now, we've also opened a couple of our recreational facilities. We opened the golf course a week ago, golf courses, because we have 3. We've got Oxbow Creek, Godwin Creek, and Bull Creek, because that seemed to be a great beta test for us as far as compliance with the social distancing. It's by its nature, it allows people to socially distance themselves, and they've had some conditions that they've implemented to allow people to use that. We're doing the same thing Monday with Cooper Creek Tennis Facility. There'll be some restrictions and some as we sort of incrementally work our way back to a fully fully engaged tennis center. We are reopening the marina, but only for gas, launching, and bait shop. We're not going to reopen the food service facility just yet. We're going to continue to monitor that. Most of the other facilities that we have been asked about within Columbus, we will probably not seriously consider opening until closer to the end of the governor's declaration of emergency, which is on the 12th of June. I want to go back to the governor's order because I need to make something clear too, and I know you guys know this, but the governor's order also extended the shelter in place for certain classifications of individual, all deemed to be the most at-risk demographics. So anybody over 65, anybody in a nursing home, or anybody in assisted living that has an underlying condition, all of those and more are still subject to the shelter in place order. We talk about this, and it's such an unusual situation. Again, I go back to that term unprecedented. It's impacted government's budgets. The state is going to be cutting. I think the governor's asked for between a 14 and 50% cut from every department. Our budget has been impacted. We will have to rely on a small percentage of our fund balance for this particular budget, and we're anticipating between an 8 and 10% drop in sales tax. Our hotel motel tax we expect to be impacted on the front end, and because of the uncertainty in our budgets, we know there's uncertainty in the citizens' budgets as well. So yesterday, council, who has done an incredible job through this pandemic, showed the foresight, I think, to approve a resolution to delay the special purpose local option sales tax vote from 2020 to 2021. We are absolutely confident that our economy is going to come back, and I think it's going to come back relatively quickly. But there's just a lot that people don't know. Even people who haven't lost their jobs are still struggling with, what's open, how do we do our job, are we working remotely? And then there are a lot of folks who have lost their job. So it's just not a good time for us to be putting that on the ballot. And I think council showed incredible foresight in doing that. They have fielded all the questions, shouldered the burden of trying to continue to make decisions on what not only allows our citizens to be safe, but also looks after the financial health of our community as well. And that's not an easy job, and they've handled it very well. But I do have to say, I tend to be sort of an optimist anyway, but the momentum that Columbus, Georgia had coming into this pandemic, I think is going to return fairly quickly. Now, there's going to be a period where people are trying to get comfortable with the new normal, because as we know, until there's a vaccine, there's never truly a completely 100% safe time to re-engage in the same manner that we did prior to this pandemic. But I feel really good about this community. I urge those of you that have an opportunity to talk to your favorite stores. If they're not following some of these recommendations, including masks, ask them why not. The way we get through this together is work together, and I think that's why our curve has stayed relatively flat on the cases, and I think that's why we have yet to have a really, really tough to handle surge in our hospitals. So I'm just so grateful for the citizens of Columbus for taking care of themselves and their neighbors and their families. I could go on you guys know me, I could go on for quite a while, but we've got about 5 or 10 minutes. I would really rather answer some questions if I can.
Hey, thank you, Mayor, for that update. Can you hear me okay?
Cameron, I can.
Okay, great. Well, I'm fielding some of the questions that have come in on the comment feed, and we really appreciate your time today and your leadership during this unusual time. I had thought myself, well, I wonder if Mayor Henderson would have run had he known, or anybody for that matter.
So we probably might have run in another direction. No, I'm just kidding.
Maybe, yeah. Oh, that's a good.
I'm proud to be with this group.
Well, we're happy to have you at the helm. A few questions that have come through. The first is, could you offer some insight to the decision of discontinuing the recycling pickup that we've been experiencing?
Yeah, really the harder one to explain for me is why we stopped the yard waste. Because we did that the yard waste we suspended for a short period of time because we were concerned with being able to get our inmates out to be able to handle that. And we wanted to make sure we did not leave household garbage on the street at the expense of trying to pick up the yard waste. The recycling was a little bit different in that we have an operation that does not allow social distancing. I mean, they actually do some separation on a conveyor belt, and that conveyor belt runs through, and both inmates and correctional officers and employees are all in this room while that happens. And we just really felt like it was an unsafe environment. However, recycling is scheduled to return on June 1st. And it may take a different look, but we'll have, I think, 5 different bins that will be open. We'll post those on our website. So effective June 1, we will start picking up the recycling, if for no other reason to get my wife off my back. So,
well, that's a good reason.
Yes, it is.
Another question. The statistics you shared of the cases and the testing, does that include Fort Benning?
Only if they reside in Muskogee County. Our numbers are broken down by county. And that's why I referenced some of the tests from the hospitals. A lot of those are given to people from outside Muskogee County, so we don't really count those. And since we're looking for trends, as long as we're using the same source for our numbers, we feel reasonably confident that those trends are accurate.
Okay, thank you. I'm going to combine questions from 2 Rotarians that were sort of similar in nature, and they are in relation to summer camps for children, boys and girls clubs. Can you provide any insight as to what the restrictions or guidelines might be for those proceeding?
We're actually still taking a look at that. The governor has, in this latest order, he has allowed day camps. There's some very tough restrictions for any camps that require overnight stays, but they are going to involve screening of the child, questioning, the parents of the child, and making sure that they have activities arranged so that they can maintain that social distancing. It's all going to be predicated on them being able to engage in activities at the camp and still be a little bit separated. But you can get that full, and we've been looking through it, but you can get the full list of requirements on the governor's webpage if you just go to his latest executive order. But they are allowed now. Now, we'll tell you this. I don't think the city is going to run their summer camps. We don't have the same level of confidence in trying to bring children together and being responsible for an unintended outbreak or something like that.
Okay, thank you. Here's a question about the remote work scheduling and how will that, in your experience, of course, managing the budget for as long as you have, how will the remote work scheduling and the reduction in those facility usage costs ultimately be figured into the budget reductions?
Well, listen, we understand that our budget's going to be impacted from a number of fronts. The city manager and I were talking just today about our transportation system. Because there's fewer people riding the system, we've gone to Saturday schedules, which is fewer buses, fewer drivers, fewer routes on weekdays. Now, that also correlates to a loss in revenue. So almost everything that we deal with is going to have some kind of impact. I think an interesting positive out of this, if you can dig deep enough to find one, is that not just governments, but I think business leaders are finding out that you can conduct business in non-traditional ways. If I'd have told you 6 months ago that I would be speaking to Rotarians across a Zoom meeting, we would have laughed, So it is going to have an impact, but I think that what that impact is at this point, while we do our best to project, and we've got some pretty conservative projectors. So we're not gonna really know the full extent of that, I think, until we get into probably late summer.
Okay, that's a good segue actually into another question here, which is to say, if you're willing, pull out your crystal ball and look 12 months into the future, where do you see the city?
If you're going to give me 12 months, I'm bullish on where we'll be. I think we are going to have probably through the winter some challenges with hotel motel tax. Our sales tax, I think, is going to rebound. We've had a few things, fortunately, that supplemented a little bit. We are beginning to get our share of internet sales tax, which is helping to supplement what we're getting now. We got a little bit of encouragement. March's numbers were down 4%. Admittedly, March was only fully impacted and fully engaged in this pandemic for half of the month, but we feel good about the sales tax. I think 12 months from now, we will have seen some type of vaccine that is going to give people a little bit more confidence to get out and get back to their normal routine. However, I think the new normal routine is going to include some type of social distancing from one another. I also think long term that this may even have positive impacts on flu and cold seasons in the future because people will know how to react to it. So we've got the 2 new hotels going up. We've got some just incredible projects that are all sitting there on the threshold of getting going. And we've got a lot of great small businesses that have opened recently. Just prior to the pandemic, we're hoping they can hang on and make it through this gap. So I feel good. I think Columbus is going to rebound, in fact, quicker than some other cities.
Wonderful. Well, thank you for your time. That we have a couple minutes left. I want to turn it back over to Tyler, but there are a number of comments here that aren't questions, but are just Rotarians thanking you for your leadership and thanking you for your time today.
Well, thank you. I always appreciate visiting with y'all, even if it's remotely.
Yeah, well, we appreciate having you, and we thank you for everything you do for us. And
thank you,
Tyler, turn it back over to you.
Thank you, Cam. And Mayor Henderson, thank you for spending time with us today. These are tough times, and you are working on some tough challenges, and you and your team are making tough decisions. And I just want to say on behalf of our 300 members, how much we appreciate you and your staff working through this, keeping us safe and keeping us moving forward. So thank you very much for that.
Thank you, Tyler.